Hi guys, so my name is Taylor Atchison and I am doing my presentation on rat lungworm disease. I apologize if it's hard for you to understand me, I'm a little bit sick right now. So for the background info, Angiostrongylus cantonensis is a parasite found in the pulmonary arteries of rodents such as rats. This parasite causes rat lungworm disease in humans, which affects the brain and spinal cord. It was first described, the parasite was first described from rats in China in 1935, and this parasite was first suspected after it was identified in the cerebral spinal fluid of a patient in Taiwan in 1944. And it was first found in Hawaii in the 1960s and then in Tahiti in 1961. And after that, it was reported throughout numerous Pacific islands. So for the classification, it is kingdom Animalia, phylum Nematoda, and nematodes are roundworms. They are mostly microscopic and can live in aquatic, marine, or terrestrial environments. They are typically agricultural pests or human parasites. The class is Cercinantia, and they are the main class of nematodes and are characterized by having an excretory system and possessing lateral canals. The genus is Angiostrongylus, and they are nematode parasites from the Angiostrongylidae family. The etymology is Greek, and angion meaning vessel, and strongylos meaning round, so round vessel. And the species, Angiostrongylus cantonensis, is rat lungworm, which may cause meningitis in humans and other species, including dogs. So, major characteristics are that this parasite is eukaryotic, filiform in both sexes, 2 to 3 minute triangular teeth. They have an excretory pore and sexual reproduction. Major characteristics anatomically is they have a tough outer cuticle, unsegmented bodies, stomal openings with fully developed gastrointestinal tracts. They are transparent with 3 outer protective collagen layers. The females, they are barber pole shaped and are usually 21 to 25 millimeters. The males, they have a posterior copulatory bursa and are typically 15.9 to 19 millimeters. And the females are typically shaped due to the intestines and uterine tubules being twisted together. So the life cycle and human environmental impacts. This parasite, it reproduces in the pulmonary arteries of rodents and gets expelled as feces. The first stage larvae either penetrate or get swallowed by intermediate hosts, which are typically mollusks like snails and slugs. And this is where they transform into second and third stage infective larvae. Human and rats get infected by eating the intermediate hosts. In rats, the larvae travel to the meninges for development and then migrate to the pulmonary arteries, where they mature into adults. And in humans, the larvae cannot reproduce, so they eventually die. And this creates what is known as the continuous cycle and causes the symptoms of infection. So here in this picture, you can see that this is a continuous cycle. So rats expel the larvae as fecal matter, and the mollusks ingest the feces, where the second and third stage larvae develop and become infected. And from here, 3 things can occur. The mollusks can be eaten by rats, again continuing the cycle, or mollusks can contaminate veggies, which infect humans, or the third thing is that it can contaminate land crabs, frogs, aquatic shrimp, and lizards, which then get consumed by humans, infecting them that way as well. Distribution of this disease and parasite. Rat lungworm is endemic to Southeast Asia and the Pacific Basin. From here, rats travel as long stowaways on ships. Outside of the endemic areas, the parasite travels through mollusks. The population infected now includes the Caribbean and the US, with Hawaii now being another endemic area. And this endemic has also spread to wildlife. Also, other endemic areas also include New Orleans and Egypt. And here is a picture of endemic countries as well. So how it affects humans: after becoming infected, the third stage larvae enter the small intestines. From here, they penetrate the walls and enter the bloodstream, and while in the bloodstream, some enter the CNS, eventually reaching the brain. Once in the brain, the larvae develop into adults, and from here, the adults are unable to re-enter circulation. So they move around in the brain tissue where they eventually die. And in the brain, they could cause no damage, but heavy infection may cause brain damage or behavioral symptoms. And neurological damage can occur due to movement of the worms in the brain and inflammation caused by an immune reaction to the worms. Moving on to symptoms of infection. Some people may have no symptoms at all, others may have mild or short-lived symptoms, and other symptoms may be really severe. Symptoms may start 1 to 3 weeks and up to 6 weeks after exposure to the parasite. And symptoms include temporary paralysis of the face, brain infection, which leads to the meningitis, and early symptoms of brain infection include headache or fever, nausea or vomiting, stiff neck, and tingling or pain in the skin. And the final symptom is eye evasion, which may include visual impairment, pain, keratinitis, or retinal edema. And next we have diagnosis. So for rat lungworm, diagnosis can be pretty hard. Doctors can review travel history to see if the parasite is present in the area that you were visiting. Doctors can also do blood testing for immune cells. So people who contract meningitis are diagnosed when they have high numbers of white blood cells, specifically eosinophils, in their blood or cerebral spinal fluid. And then the last test is the PCR test, and this test is used in cases found in Hawaii. Once administered, it detects the parasite's DNA in the cerebral spinal fluid or other tissues. So for treatment, there are no anti-parasitic drugs that have been proven to effectively treat this condition. So there is no specific treatment plan for this type of infection. However, there may be supportive treatments that may be used to reduce symptoms or the duration of symptoms. And supportive treatments can include pain medication or medication to suppress the body's reactions to the parasite, such as corticosteroids. However, dying worms release toxins which may worsen the patient, so it's important to not kill them all at once. And most people with symptoms recover fully without treatment over a number of days, weeks, or months. And in humans, the parasite cannot mature or reproduce, and they will eventually die, so the immune system will respond to it and eliminate it. It's just going to take time for it. Moving on to prevention. There's a lot of things that you can do to prevent rat lungworm, luckily. So, of course, not ingesting raw or undercooked snail, slug, aquatic shrimp, land crabs, frogs, and monitor lizards. Not ingesting contaminated vegetables. Always wash your vegetables, especially those purchased from farmers markets where they may have not been previously washed. Removing snails, slugs, and rats found near houses and gardens. Supervise infants and young children in environments where there may be snails and slugs. And always wash your hands thoroughly after gardening or handling snails or slugs. And just as a reminder, our bodies can't build an immunity to rat lungworm, so once you have it, you can contract it multiple times, which is why prevention is so important. And that is the end of my presentation. On the last page, you can see some of the sources that I used, but there's so many more things out there, and I hope you guys learned a lot. Thank you for listening.